Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I do a lot of breast surgery, and I do a lot of breast augmentation. I do a lot of lifts with augmentation, and I do breast reductions. There are some things that become popularized. There are some things that kind of fade over time. One of the procedures that occasionally comes up in the news and patients ask about is a scarless breast reduction. And people ask me, Dr. Shapiro, what is a scarless breast reduction and who, am I a candidate for it? The first thing to understand about breast reduction surgery is that depending upon how large someone's breasts are, depending upon where the nipple basically has drooped to relative to the breast fold, will be an indication of what I need to do surgically. Also, since we're removing a lot of that excess skin or skin that has been stretched out by the enlarged breast, elasticity has to do with some kind of procedures that I do and what kind of results somebody can get. A scarless breast reduction usually entails doing liposuction of the breast. So what we're doing is removing fat from the breast and enabling the skin to contract to get a perkier, smaller breast. Now, there are very few candidates for this. The reason being is that often, or most often, the breast has elongated, it's become droopy, and there's so much extra breast tissue that I can't remove it through liposuction. There are some patients, and I think it's a very few population, that are candidates for a scarless breast reduction. And once again, what I do is I perform liposuction, usually in multiple areas of the breast, and I also try to stir up some of the tissue beneath the skin to help allow the skin to contract. So we do see patients occasionally that have really beautiful results from this. They will get elevation of the nipple, they'll get a reduction of the areolar complex, they'll get a perkier breast that feels smaller, they won't have as much lateral volume, but I'd say that's pretty far and few between. A scarless breast reduction, when done inappropriately, really leaves minimal results, and people are much better off to have a traditional breast reduction, whether it be just a vertical scar or what we call a T-scar. So that anchor scar can give a beautiful result. I think across the board, scarless always sounds more enticing, but really the shape is what we're looking for. We're trying to get a consistent result that reduces the breast shape, leaves you with a more attractive breast, so you improve your self-confidence, you feel better about yourself, you feel free from the pain that you may be having in the back, and all in all, it's a win-win for both of us. So the best way to figure out which kind of breast reduction you're a candidate for, whether you are a candidate for a scarless breast reduction, come in for a consultation, bring in some photographs of the shape and size of breast that you'd like, and we'll go from there. Thank you.